Today is exactly 1 month and 3 days since baby Dorothy was admitted at Odinga Hospital in eastern Uganda. All that time, her life has hung on a thread. Although Mom and Dad have been with her all this time, Dorothy has taken little notice of them. Dorothy was born preterm or prematurely. Born at 6 months at a village health center, Dorothy was referred here weighing under 1 kilo. Today, however, the mood in the nursery is different. Dorothy's skin has turned from pink to a dull yellowish color, and her breathing has halted. And that is a bad sign. Will frantic efforts to restore her breath endure? Dorothy's story epitomizes the plight of preterm babies and their parents in Uganda. Fiona held her baby for only 1 week. Although born too soon, at only 6 months preterm, the baby showed all signs that she would live.
Then it was the nurse who realized that the baby had changed. She asked me, "Didn't you see the baby that she had changed that color?" I said, "No, I couldn't even realize her." Said, "Okay, hurry, we can put her in the incubator." The baby had changed from pink to brown. She was not moving. They tried to anyway, she had already gone.
Uganda Hospital, much like many health facilities in Uganda, has been receiving an increased number of preterm births. That comes with a number of challenges.
We've tended to prioritize HIV, AIDS, malaria and TB. We know they are important, but actually currently right now, more babies die in Uganda than the number of people who die from HIV, AIDS. Also more babies die in Uganda than the number of babies who die from malaria or TB. But the attention has not shifted to interventions, especially in the newborn health.
Some anecdotal data shows that there is a gap in the skills of the service provider, the prescriber.
So this is a major problem. We have infrastructure problems, we have personnel problems in terms of numbers, types of cadre, in terms of their training, in terms of their supervision, in terms of their motivation, in terms of their support.
A preterm birth leaves a lot of victims in its path. The parents, the health facility, the family, the community, and indeed the government, they all suffer in their own way. And where a teenager is involved, it would be hard to recover from the impact of a preterm birth.
So even when they are discharged, they find it a problem to find money to come back to the health facility for follow-up of their babies.
The special care unit at Ginger Referral Hospital is a tale of hope. The unit admits about 70 to 200 babies a month. The unit is a special initiative. It demonstrates that preterm babies can be prioritized and that they can survive and thrive.
Even within our resource limited constraints, there are success stories of babies that we have seen. Because in this unit, I think the lowest baby who has survived here is about 600 grams.
Research shows that actually doing kangaroo mother care is more effective than using incubators. So for the majority of the babies that are born in even rural areas, if brought to a hospital where there are trained health workers, then most of these babies could be saved.
Most important, the unit has a follow-up clinic. Every Friday, mothers with preterm babies come for review. Preterm Birth Initiative East Africa is another ray of hope.
The work is being done in Uganda, in Kenya, and in Rwanda, basically as a demonstration project of what can be done within our health systems to save babies, especially preterm babies.
And I think together, working together with the hospitals and the staff, we can further improve practice and further strengthen what they're doing, both in terms of clinical practice and even just tracking and data capture.
I would just pledge that Parliament will continue to support maternal health, and that you count on us to do what is necessary to improve the lives of our children, including especially those who are born preterm. And we shall be guided by the research that's coming out of this program.
A safe and healthy start in life is at the heart of human capital and economic progress in every country. We can prevent babies from being born too early and too small, and ensure that small babies get the critical life-saving care and nurturing they need.